I am Christie, and I'll be the circulating nurse for Mrs. Holmes today for her surgery. At this time, I will take a look into her medical record to review her chart and pre-op information just to make sure we have all the necessary information prior to surgery and address any pertinent concerns. So let me get into my computer here and get into the patient's medical record, logging in. All right. Today, Mrs. Tiffany Holmes will be having surgery, and the type of surgery she will be having is a surgical repair of a displaced metatarsal fracture. It will be on the left foot, the first metatarsal bone behind the big toe. The name of the surgeon is Dr. Yeshua. Skin preparation with CHG wipes has been performed. The H&P has been completed by the surgeon, which is the history and physical examination funds, and I'm going to take a look at that now. As far as previous medical history, no hypertension, diabetes, or cancer. So anything like that we're not concerned about. So anything like that is good that she doesn't have those things because that would be a concern. So medical history looks good. As far as previous surgical history, no previous surgeries. Looks great. The patient does have some allergies as far as medications. The patient is allergic to penicillin, which causes a hives reaction. Environmental allergies include pollen. Pollen causes the skin to itch. When it's in the eye, it causes the eye to swell, causing dry notes here. Benadryl helps with it, or the patient takes a shower to get the pollen off of their skin and uses honey as a preventative. As far as food allergies, the patient is allergic to pineapples, which here it says it causes itchy tongue or ulcers in the mouth. There are no allergies to latex. I'll verify this information with the surgical team to see if we need to plan for any alternative methods or materials. There's no previous surgeries, no presence of metal implants. The patient has never been under anesthesia. This will be the first time. This is also their first surgery. No family history of sensitivity to anesthesia. The patient is on some medications. No prescription medications though. Over the counter, the patient takes daily women's vitamins, women's Vitafusion gummies, turmeric and ginger tablets. As far as herbal supplements, herbal detox drinks are drunken. Looks like the patient takes Benadryl as needed for allergies. This has not been taken recently. So everything looks good with pre-admission history. Let's take a look at the patient's labs. Okay, all electrolytes are within normal limits. The BU and creatinine looks good. The surgeon has put in orders for HCG test since this is a female patient that has been performed and it is negative, so that looks great. The proper diagnostic tests and x-rays have been performed. Everything checks out well, and if there were any abnormal results, I will report this and communicate this to the surgeon and or anesthesia provider. Okay, so let me check that all preoperative orders have been completed. And as I'm looking here, okay, yep, all preoperative orders have been completed, including all preoperative medication that was administered at the correct time. As far as pre-op documentation, looks like the patient has been NPO for the appropriate amount of time and has not eaten since midnight. The patient or drunk anything since midnight. The patient was wiped with CHG this morning when they arrived. Everything looks good regarding our pre-op information that is needed. I will now head to the patient's room and talk to the patient. Hi, come in. Hello, I'm Christie. How are y'all doing today?
Good.
I'm the circulating nurse for, are you Mrs. Holmes? Is that correct?
Yes.
And I'm guessing you're the
I
mother.
am.
Okay. All right, well, I'll be the circulating nurse for Mrs. Holmes today. And I'll just going to do some hand sanitizer right here. And so that just means I will be with her throughout the entire surgery. And I will also be doing what we're about to do is a pre-op assessment. And, I'll just be making sure that everything goes smoothly throughout the surgery. Okay?
Mm-hmm.
All right. All right. And so I did my hand sanitizer already. I closed the door just so you can have some privacy. And I'm just guessing from our conversation that the primary language is English, correct?
Yes, it
Okay,
is.
so you don't need any translations. Okay. Great job. So can I get you to, I'm just going to verify your name and date of birth. Just need to see your arm thing.
Oh, yes, I'm Tiffany Holmes, 5'8",
All right. Thank you so much. Back under the covers there. All right. And can you tell me the type of procedure you're having today?
Yes, the metatarsal fracture fix behind my big toe.
Okay.
On my left. Sorry, on my left foot.
Okay. All right. Good. Can I take a look at that?
Uh-huh. Sorry.
All right. And I see that the surgeon has put his initials there.
Yes.
Okay. Great. All right. And so he's been in to see you already?
Yes.
Okay. All right, and I'm just going to get ready to start the pre-op assessment and, just verify the information that they kind of discussed with you earlier. So it's probably like a repeat. At any time you feel that something has been left out that she says, just feel free to jump in.
All right.
Okay. All right, and this is the first surgery, is that correct?
Yes, it is.
Okay. All right, are there any allergies to anything?
I have allergies to pollen, pineapples,
Okay.
and penicillin.
Okay, and what reaction do you cause?
Oh, it's just like itchiness and ulcers in the mouth, itchiness of tongue and hives. But I take Benadryl for that.
Okay, and which one is that for the pollen?
Yes.
Okay, so I have hives for penicillin, skin itching for pollen, so that's the Benadryl, and then the pineapples causes the itchy tongue or ulcers. Okay, all right. Any allergies to latex or anything like that? What about betadine or iodine?
No.
Okay, great. So I'll let the surgeon know about your allergies just to verify with them that we don't need to change any materials or anything we use during the surgery, okay?
Okay, thank you.
All right, you're welcome. And as far as the Benadryl, have you had any? I know it's summertime, so have you had to take the Benadryl recently?
No, I have not.
Okay, good. All right, great. So let's go into your anesthesia. Have you ever been on anesthesia before?
No, I haven't.
Okay, and I mean sometimes they put you on it for dental procedures, so just want to make sure, like pulling the wisdom teeth, they didn't put you under anesthesia for that. Okay, all right. And do you have a family history of sensitivity to anesthesia
No,
that you know
not that I
about?
know of.
Okay, and Mom, do you know of a family history of sensitivity to anesthesia?
No one in our family.
Okay, great. All right. So next, we're going to go over your medications. What medications are you on? I'm just going to verify the chart.
Okay, I take vitamins every day, and then I do tablets with ginger and turmeric, and then
Okay.
herbal drinks.
Okay, I do see that here. Any prescription medications?
Oh no.
Okay, that's what we have in the chart. Any illicit drug use?
No.
Okay, that's what we have in the chart as well. Okay, great. All right. And have you had any of those medications within the last 24 hours or so?
No.
Okay, and all right, great. So, have you had anything to eat or drink since midnight?
No, I have not.
Okay, good, good. That's good. It means you follow the NPO orders. Good. All right. So, do you have any open wounds, cuts, scrapes, or burns that we need to know about?
No, I don't.
Okay. Any previous surgeries?
No, this is my first one.
Okay, I do remember you telling me that. And do you have any metal plates, such as rods, screws, metal plates, anything like that?
No.
Okay, good. All right. And I'm just going to take a look at your skin just to make sure that you don't have anything that we'd be concerned about for positioning.
Okay.
Okay. All right, and your back. Okay. And I just will you can go ahead and cover yourself. I'll just take a look at your stomach. Okay, and your feet. And I'm sorry, your legs.
Oh, okay.
Sorry, I don't know what I'm doing. Okay, good. And you don't have any thing on your bottom, such as sores or anything like that. Okay.
Oh,
And like I said, that's just for position and purpose, just to make sure we don't have any pressure on those type of areas. If you did have that, we have to adjust the positioning.
Okay.
Okay, and I just need to check and make sure you have your informed consent here. Oh, looks like we have informed consent, so that's great. And it looks like we have a witness that has signed it. So how are you feeling about the surgery today?
I'm a little nervous, but then when I heard about Dr. Yeshua and how great he is, I said, well, okay.
Okay, all right. And well, I'm glad to hear that you're feeling better. We do want to make sure we address any anxiety because honestly, based on what you're saying, is the anxiety pretty low?
Yeah, I don't have any.
Okay, and what about for you, Mom?
I'm good.
Okay, all right. Just want to check since it's your first procedure. And like I said,
Mhm.
Dr. Yeshua is a great doctor, so he'll take great care of you. He's done the surgery before. He's great at it. He was successful at it, and I know he'll do a great job for you too. And I'll be with you the entire time just to make sure everything's going smoothly.
Okay.
Yes, I'm here. Okay, and any other questions or concerns? Anything that he didn't answer that I can address for you guys?
Mhm.
Okay.
Thank you.
All right, you're welcome. And when was the last time you went to the bathroom?
This morning around 6.
Okay. All right, so it's about a little later now. So did you want to go ahead and try to go to the bathroom again?
Yeah, I would need to go.
Okay, so I'll assist you to the bathroom. And any needs I can meet for you culturally or spiritually?
I like to talk to the chaplain to get prayer before the.
Oh, sure. I'll call the chaplain after we get you up from the bathroom and see if him or her can come on down. They're here 24/7, so we'll definitely get that for you. Would you like to be in the room at the time?
Oh,
Okay, well, we'll send them on down.
Okay, thank you.
Okay, and your call bell is there, and just that big button right here in the middle. You'll press
Okay.
that if you need any assistance with anything else prior to us going back.
Okay.
Other than that, I'll get you to the bathroom, call a chaplain, and then I'm gonna head back to the operating room just for us to finish setting up, and then I'll come back. And just a last minute check. I see you have all your clothing removed and you do have your gown on.
Huh?
Okay. Do you and you don't have glasses, but do you wear contact lenses by chance?
No, I don't.
Okay.
Mm-mm.
Any hearing aids or dentures?
No.
Okay. And I do see you have the ear piercings. Any other piercings on your body?
No, these are the only ones I have.
Okay, so you can't have the earrings in the operating room, so we're just gonna ask that you remove those prior to the surgery. Are you okay giving them to your mother?
Yes, yes.
Okay, so mom, can you okay holding on to those for us?
Yeah.
Okay, great. And so after this, once we take her back for the surgery, we're gonna escort you to the waiting room.
Okay.
And then like I said, I'm the circulating nurse. I'll be with her the whole time.
Okay.
And I will call you periodically just to give you updates and let you know how much longer we have on the procedure.
Sounds great.
Okay, any other questions I can answer?
No, that's it.
All right, well, I'll be back soon. Get you to the bathroom, then I'll be back soon.
Okay, thank you.
All
Thanks
right,
so
thank you,
much.
Mrs. Holmes.